Hi, nice to meet you all. My name is Dr.Ragavan. I am a Uro-Oncologist. I am a specialist in urological cancers. Today we are going to talk about male infertility. That is, infertility due to male components. Infertility is it roughly happens in about 10% of the couples across the world, and the male component of it forms an important aspect of the infertility as well. The definition of infertility is that a couple who is not able to conceive in spite of having unprotected intercourse and together for one calendar year. Many of the couples nowadays are asking for infertility treatment within a few months of marriage. That is not required. Up to 1 year, a natural conception can happen, and therefore that time has to be given. Once somebody has crossed 1 year, they start the workup for infertility. They may find that the male component is there which needs attention. So every man are born with two gonads, two testicles, which produces the sperm itself, which is mixed with fluid, and that fluid is further augmented in a gland called prostate, and that is coming out during the intercourse. The fluid that is coming out during the intercourse is called semen, and it contains the sperm and lots of other things which keeps the sperm alive. Once ejaculated, the sperm travels inside and is able to penetrate one of the ovum, which is released, and that forms the baby. So what we really need is adequate volume of sperms which can travel, because we have to understand that some of the sperms will die in the process, and they are able to travel and they are able to penetrate the ovum to produce a child. What are the components of male infertility? Some people will have less amount of sperms called oligospermia. Some people will have sperms that doesn't move well called asthenospermia. In some people, the sperms may not have good arrangement called teratospermia. Or some people will have all three called oligoasthenoteratospermia or OAT syndrome. In a small number of patients, there will be hardly any sperm production at all because the testis is not working well. So how to treat these patients? The first thing you need to notice is that simple intervention itself improves sperm count. That includes adequate water intake, make sure you have good hydration, loose underwears, not tight ones, not having a lot of exposure to radiation, that includes cell phone as well, and computer screens. These things itself will improve the sperm count. In patients who are not able to have that improvement beyond that, medical therapy is available, which once again helps in the improvement of the sperm count. If some patients, in spite of all these things, the sperm count doesn't increase, they may have an obstruction in the tract which is not allowing the sperm to come out. In those patients, something called testicular or microscopic extraction of sperms will allow them to take sperms out and create a baby, what we call test tube baby or artificial, a method of conception. Very, very rarely we will do biopsy of the testicle to take it out as well. And in a very, very small proportion of patients where adequate sperm is not available, donor sperm is also available for conception. So friends, male infertility is reasonably treatable. Adequate precaution itself reduces the chances of male infertility. And lastly, if there is a male infertility problem, we can manage it in a scientific way and give the joy to the couple, which is to have a baby. Have a nice day.